Today, we're going to discuss the toxicology of baclofen, a centrally acting muscle relaxant. Baclofen is primarily used for treating spasticity associated with conditions like multiple sclerosis, spinal cord injury, and cerebral palsy.
Here I come.
However, baclofen toxicity can occur with overdose, whether accidental or intentional.
Come on now, dawg. Come on, man.
And it can present significant challenges in clinical management.
I beg your pardon?
Our lecture today will cover the mechanism of action of baclofen, the symptoms of toxicity, and the appropriate management strategies.
Sensational.
Baclofen is a GABA B receptor agonist. Unlike benzodiazepines, which act on GABA A receptors, baclofen's action on GABA B results in inhibition of excitatory neurotransmitters like glutamate and aspartate. By increasing inhibitory tone, baclofen reduces the release of these excitatory neurotransmitters in the brain and spinal cord, leading to decreased muscle spasticity. In the context of overdose, this mechanism is exaggerated, leading to central nervous system depression. The overactivation of GABA B receptors suppresses neural activity more than intended, causing profound sedation, respiratory depression, and hypotonia. Additionally, baclofen has a narrow therapeutic index, which means that even relatively small increases in dosage can result in toxic effects. In patients with impaired renal function, even therapeutic doses can accumulate, leading to toxicity. Regarding the symptoms of baclofen toxicity can range from mild to life-threatening, depending on the dose ingested and patient factors like age, renal function, and concurrent medications. The key symptoms of baclofen toxicity include CNS depression. This is the most common presentation. Patients may exhibit confusion, dizziness, and somnolence. Which can progress to stupor or coma in severe cases. Due to its suppression of central respiratory centers, baclofen can lead to hypoventilation and respiratory arrest. This is a major cause of mortality in baclofen overdose. Hypotonia and hyporeflexia. As baclofen inhibits neurotransmission in the spinal cord, it can cause generalized muscle weakness, plasticity, and reduced deep tendon reflexes.
Look at me! I got no bones.
Seizures. Paradoxically, some patients may experience seizures, especially if there is an abrupt cessation after chronic use, or if there is a massive overdose that overwhelms the inhibitory effects. Autonomic instability. Symptoms like bradycardia, hypotension, or even paradoxical hypertension can occur, complicating the clinical picture. Other symptoms may include nausea, vomiting, and visual disturbances. Hallucinations and delirium may occur in cases of abrupt withdrawal or in those with pre-existing psychiatric conditions. Management of baclofen toxicity. Now, the management of baclofen toxicity primarily involves supportive care, as there is no specific antidote for baclofen overdose. Let's break down the key elements of management. Airway management. This is the highest priority. Priority number uno. Patients with significant CNS depression or respiratory depression may require endotracheal intubation and mechanical ventilation. Monitor respiratory function closely and consider intubation early if there are signs of hypoventilation.
That's a great idea. I'm with that.
Cardiovascular support. For hypotension, Intravenous fluids are typically the first-line treatment. If fluids are inadequate, consider vasopressors like norepinephrine to maintain blood pressure. Decontamination. If the patient presents within 1 to 2 hours of ingestion and is stable, activated charcoal can be administered to reduce absorption, though this should be avoided if there's a risk of decreased consciousness or seizure due to the risk of aspiration. Enhanced elimination. In cases of severe toxicity, especially in patients with impaired renal function, hemodialysis can be effective in removing baclofen from the circulation. This is because baclofen has a low volume of distribution and is water-soluble. Seizure management. Benzodiazepines like lorazepam are the first line for treating seizures associated with baclofen toxicity. They enhance GABA A receptor activity and can help counteract the paradoxical excitatory effects. Monitoring and duration. Patients should be monitored in a critical care setting until symptoms resolve. The duration of toxicity can be prolonged, sometimes lasting up to 72 hours, depending on the dose ingested and the patient's renal function. In summary, baclofen toxicity can present as a serious, life-threatening condition with CNS and respiratory depression, hypotonia, and autonomic instability. While there is no specific antidote, supportive care and early intervention can significantly improve outcomes. Remember the importance of securing the airway, considering hemodialysis in severe cases, and using benzodiazepines for seizures. As always, keep your head up. You're doing great. You're better than what you were yesterday. And that's a lot. Learn something new today. Gonna be a great doc. Sometimes you just gotta hear that. Are you an emergency medicine professional or a medical student eager to sharpen your toxicology skills? Well, look no further. EM Toxicology Trainer is your go-to app to mastering the essentials of toxicology and toxicological emergencies. With EM Toxicology Trainer, you can dive into the mechanisms, symptoms, and treatments of common overdose scenarios right at your fingertips. Learn what happens in the body when venlafaxine levels go too high, or how to handle a dangerous Tylenol overdose. Our app makes learning toxicology easy, with concise explanations that reinforce your knowledge to go. No more scrambling through textbooks or online searches when time is critical. Whether you're in the ER or prepping for exams, EM Toxicology Trainer gives you the confidence to tackle toxicology cases with precision and speed. Download EM Toxicology Trainer today and become the expert your patients need when it matters most. Available now on iOS and Android.